Oh, hey, good to see you guys. You caught me at my desk. Let me go over with you what I like to see in a desk. And just so you know, this is not a permanent desk for me, but it's one that we use as a prop here or is in our exam room. Check out the exam room. So I want to let you know this isn't the setup that I always use, but I'm using it today for this video to show you good and bad. First off, some of the things that I love to see in your chair is that it's got a number of different movable components so that it can go up and down and so that it can tilt forward and back. The next thing I like to see is that it lifts up so that your butt is resting on it, your knees go to a 90-degree angle, and your feet hit the floor. Next up, I want to see your hip is at a 90-degree angle with a good lumbar support in it. And now the lumbar support doesn't go at my tush, it goes where my lower back is. I like to see the armrests that can wind up moving so that if you have short arms, they're higher, and long arms, they're lower, but I like for them to be rested at neutral, not up high and not way down low. I want you to be able to walk into your desk with your feet. Put your wrists right onto the deck right in front of your computer with your monitor right in front of you and keyboards. Now for me, and laptops are not designed for long-term use. So if I were going to use this for long-term use or at my desk or to be at home in my office, I would look to wind up setting this up on a set of books. Oh, wait a second. I actually have them here for when I do longer-term work. What this does is it brings my monitor up to eye level. Now, I would look to also have a keyboard that could stay down here, whether it's Bluetooth or cabled in. That would allow for me to be in a more ergonomic position. If you've got questions about it, I'm going to attach down below in the links my favorite chair. It's really been outstanding for a lot of our patients to wind up using, and it can help you as well to sit in that right position. I may also put a few other tools like a lumbar support that we love that you can use. Keys are not at your butt, at your lower back. This is super important, especially if you've been dealing with sciatica, making sure your desk space is right. If you've got more questions, go ahead and write them down below. We'll do our best to answer them for you.